Today is Tuesday, April 21st, and today's hot topic discussion with industry experts is with Lee Hart, President, Safety by Design, and Cesar Garcia, Assistant Safety Manager, MEMCO, and our current chair of our ASA Safety Committee. And today's topic is COVID-19, OSHA Recordables, and Good Faith Effort. And I forgot to say, I'm Brianna Wright with ASA Houston chapter. So, gentlemen, back in March, OSHA published enforcement guidance about COVID-19 and recordables, and basically said that COVID-19 could be recorded as an incident, but it was work-related and otherwise satisfies OSHA's recording requirements. The term work-related got a lot of our members confused, not knowing what exactly they meant by work-related. Then on April 10th, OSHA came out with temporary guidance and further explained what work-related meant, what it means, and what's required. So with that, Lee, can you explain the guidance that they issued on April 10th, under what circumstances an employee would be confirmed with COVID would be a recordable on the OSHA 300 log?
Sure. So the memo that came out, it says that other than the healthcare industry and emergency response organizations, that OSHA would make work-relatedness determinations, but they would not enforce it with other employers except for a couple of different scenarios. And really, just to kind of let me back up just a little bit. First and foremost, because this is so new, this changes all the time. So anything that we discuss in this video could change hours from now, days from now, weeks from now. But what essentially they're saying is that it's going to be pretty difficult to determine work-relatedness because of the fact that this is the community transmission of this disease, and so that it could have happened outside of work. What they say specifically is that OSHA will not enforce 1904 to require other employers to make the same work-relatedness determinations except where there is objective evidence that a COVID-19 case may be work-related. So let me stop there real quick and just explain what work-related, or how they define work-related. It's an event or an exposure in the work environment that either caused or contributed to the resulting condition, whether it be an injury or an illness. So that's how they define work-relatedness. So that can be very difficult with COVID-19, right? So what they've said here under this first one is that an example might be a large number of cases within a project, or large spike within a particular crew. And one example might be the pork plant in South Dakota just recently shut down because hundreds of people were diagnosed with COVID-19. So it's very likely that many of those, if not all of them, were work-related. The other piece that they put in here was that there would be, if there was evidence reasonably available to the employer. I actually spoke with Mark Briggs a little bit about this. He's the South Office Area Director for Houston OSHA. And we talked about this one specifically, and it's really a little bit more personal. And basically, if an employer receives information from the employee that might be reasonable to expect that case was work-related, then they may be expected to record the case. That one's going to be a little more difficult because I think the employer can also look at that. And if one employee comes and says, hey, I got this at work, but nobody else has it, then it might be reasonable to suspect that it didn't happen at work. So it's a very kind of a sticky situation, but all in all, really, to be honest with you, all the recording criteria is still, it is now what it was before COVID-19. So there's basically a flow that has to be followed. Was there an injury or illness? That's the first question you have to ask yourself. So with COVID-19, it's not a suspected case, it's a confirmed case first, okay? So a confirmed case would be the illness. Then is it work-related? That's where the hang-up is right now, and that's where you have to determine whether or not other people at the job site are are also contracting the case and are positive versus just this one person. If you get past that point and you actually determine it's work related, it still has to meet the other recording criteria. Was there medical attention beyond first aid? Was there lost time or restricted duty as a result of it? You know, and I talked to him specifically about the 14-day quarantine as being potential lost time. And he said if it's more precautionary, then that wouldn't likely be considered lost time. It wouldn't likely be considered a recordable case. I want to be very clear, not to you know, be definitive about that. It may not be, but medical attention beyond first aid, if somebody gets put on a ventilator, it's probably going to be a recordable case, right? So this is something that we wouldn't normally do as a first aid measure. But again, you have to kind of get past that work relatedness point. And to date, about the only example I've heard of would have been like that South Dakota pork plant. So if employers just continue to do what the CDC recommends and keep following these guidelines and putting forth good faith efforts to, you know, keep their employees safe, you know, practice social distancing and things of that nature. The good faith effort is something also that I think OSHA is going to look at, and if it comes to the point of having to make a determination about recordability, what are you doing specifically to kind of avoid this from becoming an outbreak at your workplace? And so, you know, Cesar would probably be more inclined to talk a little more about those good faith efforts. So.
Yeah, so when we're talking about good faith efforts, we're really just talking about, you know, our employers doing or taking precautionary steps to protect their employees or to reduce the risk of exposure to their employees. Like I was mentioning earlier in our conversation during the committee meeting, you know, because of the limited availability of trainers and employees, sometimes even because of everything that's going on, it might not be possible to follow all the recommendations or all the requirements for, you know, training for face masks or N95s. The availability of that has been obviously brought down. So basically what OSHA is looking for is, hey, are you taking care of your employees the way that you should be per OSHA regulations as a, you know, as a norm? So some of the different things that employees are doing, and it definitely does count towards that employer if they have this in a written form, because obviously, you know, if it's not black and white, it doesn't exist. So some of the things that we've seen are, we have contractors that are taking their employees' temperatures before starting work. They take it during the workday, and then they take it after they end their workday, before they leave the job site. And that's just to keep a track of, hey, are my employees still in good health while they're working? And there's a better chance of catching anything, you know, if you're doing intermittently like that. There's providing extra hand wash stations throughout their different levels, hand sanitizer. There's contractors that are cleaning or disinfecting their tools, equipment, the common areas. They're alternating breaks or lunch schedules as well, and limiting the amount of people that are going off on break at the same time. And then even then, they're also enforcing the social distancing, you know, where you have to maintain your 6 feet apart from each other, not congregating. We're talking about doing virtual safety talks or toolbox meetings, or having a smaller crew coming in. So those are the different things that employers can do that are within our control, right? To help limit the exposure. And so basically when we talk about recordability, is if employers are doing these steps, if they're doing these things, then we're preventing the spread of the virus or the illness, and thus we're also preventing the number of recordable cases or illnesses that are coming from it. And so that's why it's important to be implementing these good faith efforts. there's like Lee said, there's a lot going on that's changing, per the hour, per the days, per the week. So we don't know what it is, and so relying on these good efforts to stay on top of those things is really important.
That's fantastic. That helps clear it up for me. So I know if it clears it up for me, it'll clear it up for a lot of people. Is there anything else based on those the what's going on with the recordables and the good faith efforts? Anything else you guys want to throw in? Because you answered all my questions. So
I think just staying vigilant and staying on top of it, and sharing as much of the accurate information that's being put out by CDC and health experts. I shared the websites for the CDC where they show how to make the masks. I mean, those are easy steps that people can do at home and we can encourage them to do, and even for employers so that they can help provide those good faith efforts to their employees. Lee?
Yeah, I agree with what Cesar said. Just I mentioned earlier, we can't run from this virus. So let's just keep doing the things that seem to be working. I did see some stats earlier. Texas, comparatively speaking, has very few cases. I think there's just around 20,000 confirmed cases in the entire state of Texas, 522 deaths, and I know one death is too many, but comparatively speaking, they're low numbers, and from what I've heard, Governor Abbott was on just a little while ago talking about how those numbers seem to be even declining. Well, and so, and I think that's from ramping up some testing efforts, and then as well as what Cesar said, just following all these guidelines, which, if you think about it, aren't really things that we shouldn't have already been doing anyway, right? Practicing good hygiene, washing our hands, sneezing into our arms and coughing into our arms and things like that. So if we just keep that up, I think we'll continue to see job sites continue to perform at maximum level and occupancy, so to speak, and we won't have all these potential recordable cases that everybody is seemingly worried about for good reason.
And Cesar, I want to just build on something that you said with the information, sharing the information, and Lee, like you said, this stuff changes all the time. For ASA members, if you are not already on the safety committee, I highly suggest that you put somebody on the safety committee, because they're meeting once a week on a video call and they're sharing this kind of information. And if you're watching this and you're not an ASA member, if whatever trade organization you're a part of, if you have a safety committee, get on it and encourage them to have weekly video calls right now, so we can all be out on these job sites safe and everybody has the information that they need.
Yep.
So one thing that we always do to end these is ask the people, our industry experts, to tell me something good. So Lee, I'm going to start with you. Tell me something good.
Okay. So I actually think in all of this, there's silver linings. I've heard your other ask the industry experts, and obviously people are closer to their families and things like that, getting projects done that they wouldn't have otherwise got done. And for me, something good is just the way that at least our team, and I think this goes with most employers right now, how everybody really kind of comes together and is willing to do whatever is necessary to help. And as with Safety by Design, we immediately went into looking at how we could do virtual training for everybody and still continue to offer those services that we've come accustomed to offering over the years, and doing it in a way that still allows us to maintain the guidelines that are set forth. And so for me, is really just kind of seeing how everybody is coming together, and I think we hear stories about that every day on national TV, but it's happening here locally as well. So.
Hey, Cesar, how about you? Tell me something good.
Oh, well, I'm all COVIDed out, okay? There's a lot of COVID talk, and yes, it is good to see all the good Samaritan stories that are coming out of this, people helping each other out. But I also love baseball, And, it has hurt me that the season is not happening. But the good thing is that the Houston Astros are still 2017 World Series champs. So, that's all I leave it at.
That's perfect. That is good. That is good. All right, well, gentlemen, thank you so much for taking your time today. I know you've got a lot of other things you need to be doing, so I appreciate it. And you have a great rest of your day, and stay safe out there.
Thank you. All right.